Hello, today's presentation is going to be over cirrhosis. My name is Ashley Wells, and this is for St. Mary of the Woods College, class NU 550, Clinical Management 2 with Dr. White. Today's learning objectives are going to include the pathophysiology of cirrhosis of the liver, risk factors, clinical presentation, prevention, diagnostics, treatment, and then we will have a case study with case study questions at the end. All right, we're going to get started with the patho side of cirrhosis of the liver. So we're going to go through like the different stages or steps that lead to the cirrhosis. So first, we're going to start with a chronic injury and inflammation. And this is like repeated damage from causes like viral hepatitis, alcohol abuse, or autoimmune diseases trigger a persistent inflammatory response in the liver. Then it leads to the stellate cell activation. So normally the stellate cells, they store vitamin A. During chronic injury, they become activated and they transform into myofibroblasts, which produce excessive fibrous and connective tissue. And then we have these fibrous, which is scar tissue. It gradually replaces healthy liver tissue, forming these fibrous bands that disrupt the normal liver architecture and the blood flow through the sinusoids. And then the nodule formation. These fibrous bands, they separate islands of regenerating liver cells. They form these nodules that further distort the liver structure. So once we're forming these nodules and the liver structure is distorted, then we start to see portal hypertension. So like scar tissue and nodules, they impede the blood flow through the liver's portal veins. This causes blood pressure to rise in the portal vein system. So once we have this blood pressure rising in the portal vein system, then we start to see a decline in function. So as the livers become more scarred and its structure is destroyed, its ability to perform like vital functions like the detoxification, bile production, and synthesizing proteins is severely compromised. This can lead to like a buildup of toxins, jaundice, and the inability to properly metabolize nutrients. So when this starts to happen, we start to see vascular changes. And so the liver's blood vessels, they're affected in all this. The normal specialized capillaries, which are the sinusoids, they undergo capillarization. It's becoming more like a standard, like the capillaries, it increases resistance to blood flow and it worsens that portal hypertension. So we keep having this buildup. Furthermore, the production of vasodilating molecules like the nitric oxide decreases, further contributing to like a vascular resistance and portal hypertension. So now that we kind of heard the patho behind it, let's see what the risk factors of cirrhosis of the liver is. So there's some interesting ones on here. So hepatitis and other viruses, which are common with cirrhosis, that's kind of what we've heard. Long-term alcohol abuse, non-alcohol fatty liver disease, autoimmune disorders, blocked or damaged bile ducts, and uses of certain medications, which we know those are the medications that's going to harm the liver. Exposure to certain toxic chemicals. This one kind of had me thinking because I was like, okay, I've seen all these others listed. I didn't think about exposure to toxic chemicals. So that one kind of was like, oh yeah, that one makes sense. Repeated episodes of heart failure with blood built up in the liver, which that one kind of didn't think about. Oh yeah, that is connected with cirrhosis. So I found that one interesting. And the last one that really interested me was the parasite infections. Didn't think of that one. That one was definitely stood out to me, and I'll remember that from now on. All right, so now we've heard the patho side of it. Now we've heard the risk factors of cirrhosis of the liver. Now let's move on to what our patients would complain of or what they would present with. So, extreme tiredness, easily bleeding or bruising, loss of appetite, nausea, swelling in the legs, the feet, or ankles called edema, weight loss, which I found that one kind of interesting because I would think weight gain would be more because we talk about swelling and this edema. So I found that one interesting. Itchy skin, yellowing of the skin and eyes, which jaundice, which that's very common presentation in patients that present with cirrhosis. When I think of cirrhosis, I think of jaundice, I think of ascites, which that'll be our next one, which is the fluid buildup in the belly. That's ascites. And over here on the left side of the slide, it kind of just shows the difference between normal, or like a normal patient, and then what ascites would look like. And it also shows like how the ascites, how the fluid builds up in the abdomen. Spider-like blood vessels on the skin called spider angiomas, redness in the palms of the hands, pale fingernails, especially in the thumb and index, and then clubbing of the fingers, and then confusion, drowsiness, or slurred speech. And that is like more farther down, like cirrhosis, all that buildup that we talked about in the patho. That's what we're going to lead to the confusion, the drowsiness, or the slurred speech. All right, so now the prevention measure of cirrhosis of the liver. Biggest one, number one on the list, do not drink alcohol. If you have liver disease, you should not consume any kind of alcoholic drink. Eat a healthy diet. We want to choose a diet that's full of fruits and vegetables. Select whole grains and lean sources of protein. We need to make sure that our patients understand to cut down on the amount of fatty and fried foods you eat. So I kind of put on the left side of the screen, I kind of listed some healthy liver diet that we could educate our patient on. And then maintain a healthy weight. So too much body fat can damage the liver. So we want to make sure that we are talking with our patients about creating a weight loss plan if they have a high BMI. And then lastly, reduce your risk of hepatitis. So sharing needles and having unprotected sex, they can increase your risk of hepatitis B and C. So we want to make sure that we are educating and promoting hepatitis vaccines, especially to our vulnerable patients. All right, so next, how do we diagnose cirrhosis of the liver? So we can order blood tests. These will include like liver function tests to see if the liver is working the way it should. You may also have tests to see if your blood is able to clot. A liver biopsy. So small tissue samples are taken from the liver with a needle during surgery. The samples are checked under a microscope, and it's found out to like what type of liver disease a patient has. A CT scan. So this is an imaging test that uses x-rays and a computer to make detailed images of the body. A CT scan shows details of the bones, the muscles, fat, and organs. We can also order an MRI. This test makes detailed pictures of the organs and structures inside your body. It uses a magnetic field and pulses of radio wave energy. A dye may be injected into the vein. The dye helps the liver and other organs be seen more clear on the scan. And then we can do an ultrasound, which this just shows your internal organs as they work. It checks how blood is flowing through different blood vessels. It uses high-frequency sound waves and a computer to create images of blood vessels, tissues, and organs. So I added a picture here in the upper right portion of the slide. It shows what a healthy liver looks like and what a liver that has been diagnosed with cirrhosis looks like. And the main takeaway here is so in the normal liver, you can see like the hepatic veins, you can see the portal vein branches in this image. When you go over on the left side of the picture, it shows the liver cirrhosis, and none of those are visible. So found that interesting. All right, so now that we have diagnosed cirrhosis of liver, how do we treat it? So when researching this, several sites said the same thing. First, we're going to treat the underlying cause. So we want to educate our patients with alcohol dependency about proper treatment plans for them. If a patient's BMI is too high, we want to educate about weight loss. And then if a patient has known hepatitis, we want to make sure that they are on the correct medications to control the hepatitis. And then the treatment plans for the complications of cirrhosis, we really want to make sure that we're educating our patients about a low sodium diet and diuretics to prevent the fluid on the body. And for severe cases, a procedure called a paracentesis can be performed. In the ER, I've been a part of several of paracentesis done at bedside. It's very interesting, and I did not realize how much fluid can come out of the abdomen, so that's interesting. Certain blood pressure medications to control portal hypertension. And then medications to reduce hepatic encephalopathy. And lastly, a liver transplant. Just something interesting that kind of stood out to me. A few weeks ago, I went to the Indiana Donor Network conference. They talked about liver transplants, and a speaker said something that really stood out to me, that he's a surgeon, and he said a lot of patients are very open about heart and lung and kidney transplants, and patients are more kind of standoff about their liver transplant. They stated that a lot of people are nervous about the stigma that comes with liver transplants. They said that patients are worried that people think, oh, they used drugs or they were abusing alcohol. So those kind of, that conversation that the speaker talked about, I don't know, it just really stood out to me, which it makes sense, but yeah, just found that interesting. All right, and now on to the case study. So John is a 53-year-old male. He presents to the office today with complaints of yellowing skin and eyes, extreme tiredness, nausea, loss of appetite, and abdominal swelling. History includes congestive heart failure, hepatitis C, and hypertension. Patient states he consumes a 12-pack of beer a night and occasionally uses chewing tobacco. John is not compliant with his CHF and hypertension medication due to forgetting to take the pills. It is noted today that John has gained 15 pounds since his visit 3 months ago. And some questions to go along with the case study. What risk factors of cirrhosis does John present with today? What type of testing will we likely order for John? Would we refer John? If so, where? And would this be an urgent or non-urgent referral? And here is my concept map that I created over today's presentation. And here is my references from today. If anybody has any questions, please feel free to reach out to me in email, ashley.wells@smwc.edu. I'd be happy to answer any emails or questions that you guys have. Thank you for listening and enjoy your day.